This clinical case belongs to Paul Couderc and was explained in the Banquet des Points, number 28, in January 199. It concerns Monsieur Rene, married and father of 8 children, aged between 43 and 33 at the time. The man was in shock due to the recent death of one of his sons and immediately stated that he had no future. Among his medical history, there was a pre-military depression, dysentery, amoebic dysentery, and malaria crisis during military service. At the age of 50, he suffered from a low back pain and a crural pain episode, and in his 60s, he experienced kidney colics and plantar warts, as detailed by Dr. Couderc. For the past 2 years, Mr. Rene had endured a series of medical issues. A year ago, he developed a right sciatica neuralgia with vague clinical characteristics affecting the buttock, the posterior aspect of the thigh, and transfixing vertically through the forefoot. It turned out to be a disc herniation that quickly led to functional impotence, requiring walking assistance. Additionally, he underwent surgery for an abdominal aortic aneurysm and the removal of a colon adenocarcinoma. Interestingly, during the postoperative period of both surgeries, the leg pain had significantly improved. Monsieur Rene struggled to get going in the morning. His difficulty sleeping at altitudes was interpreted by Paul Couderc as Furthermore, he experienced right-sided hemicranias with dizziness, tearing, nasal obstruction, and recurrent oral ulcers. He disliked milk, and his stools were usually soft. In summary, Paul Couderc described a depression due to grief, combined with a series of abdominal, radicular, vascular, and tumoral alterations. The tongue, large and pale, indicated hand-shape analysis revealed an earth typology. His pulses, deep and slow, predominantly manifested on the right side. How should we interpret these pulses? Moving on, Paul Couderc described the patient as a former business leader, corpulent with a prominent belly. Monsieur Rene was sympathetic and somewhat talkative, describing his symptoms with precision and a lot of details. Despite appearing as a tribal chief with initiative, he seemed effectively supported or perhaps guided by his wife when discouraged. Couderc's analysis of his physical and behavioral typology was as follows. The corpulent body and abdominal dominance pointed, and the sympathetic, talkative, tribal chief behavior evoked a Yang Ming energetic level. The patient's verbosity regarding symptoms denoted an obsessive tendency typical of the earth element. At present, the most bothersome symptom for the patient was the right sciatic pain. Dr. Couderc started by needling stomach 26, resulting in a slight improvement in the overall state. However, after 2 sessions, the pain reactivated. Subsequently, stomach 27 was attempted, but this also proved ineffective. Stomach 37 was then tried, a point that descends Qi and is related to Chong Mai, but it didn't work well either. Then, bladder 25, Dumai 3, bladder 40, and bladder 60 were successively stimulated. However, Monsieur Rene needed to be hospitalized again due to pain. They were investigating for possible bone metastasis, which they did not find. At this point, he became an unpleasant and infernal person with his family. Dr. Coder found him loaded with opioids, discouraged and desperate. Recognizing the level of depression he was experiencing, Coder tried large intestine 11, known to be useful in depression. His general condition improved, but despite medication, there was persistent vague discomfort in the legs that compelled constant movement. Finally, the point that resolved the clinical picture was which truly improved the pain to the extent that opioid medication was no longer needed. Coder repeated the point after a month, and the patient has not been seen again. Why did this point work?